Welcome to your show, and that is Health is Wealth. And thank you so much, viewers, for your continuous support to us. And today, actually, we are crossing our 2 months. And I'm really happy that we are all concentrating about our health and how we can be healthier each and every day. Let's welcome Dr. Mehrotra once again in our show. Dr. Mehrotra, welcome again.
Thank you so much, Ragini, for having me on. It's a pleasure to be back again and again with a different topic that I think will hopefully be beneficial to our viewers.
Absolutely, and for that reason, this week, not even this week, this whole month, we really want to dedicate our old episodes towards mom. And that was the plan, and that is why tonight also we are going to celebrate Mother's Night one more time. What do you think?
Of course, that's great. And actually, moms, or you can make it women's.
Yes, absolutely.
So, women's health. And this is the time for talking about women's health and focusing on women's health. And I think it's one of those things where the majority of our women in our community do not put themselves up as first. They always look at their family, they always look at their spouses, their kids, and then come the women. But we're here to tell them that women need to be looked at by themselves, by everybody else, and to make sure that they take care of themselves.
All right, and for that reason, in studio, we have two beautiful, lovely ladies with us. And why, Dr. Mehrotra, you take the lead to introduce them with our viewers?
Sure. Tonight we have the honor and privilege of having Dr. Ushma Patel to the right side, and we have Dr. Nutaki. Both of them are OBGYNs in the area and very prominent and wonderful, well-established OBGYNs who are going to educate us today. So welcome, ladies, and thank you very much for being a part of the show.
Thank you for having us.
Our topic for tonight is women's health. So what we can really say that what is women's health?
Well, it actually constitutes quite a bit, and I think you'd be surprised to hear what we actually do. When I see a woman in the office, it can be of any age. We can talk about anything, and it's very important to know that that's her time to ask us anything, okay?
And women's health is not just a lab test or an ultrasound or a certain scan. Women's health really is preventing disease in women. That's what women's health is all about. Taking care of themselves and preventing disease.
So, Dr. Nutaki, what we see or what we hear, I know as a pediatrician, I hear a lot from many of my moms who are first-time moms that they have never been to a physician until they get pregnant.
Yes.
Is that been your experience, and how do you actually address that?
Yes. Okay, there's a lot of times when they first come in with a pregnancy test positive and we're going history over them, with them, what we find is most of them have never seen a gynecologist before. They may have seen sort of like a primary care with for basic blood work and all that, but they've never seen a gynecologist before. Because they assume, I don't have any issues with my period, so I don't have to go to a gynecologist till I get pregnant. But actually, you're supposed to start pap smear screenings at age 21. So, and you are actually supposed to establish care with a gynecologist between 13 to 15 years of age. Not for an exam, but actually education to see about your cycles, about your developing body. And then we move on, and at that visit we usually tell them when to come back for testing, at what age and all that. So they get educated about their health care at that visit between 13 to 15 years of age. And then at 21 is when we really start seeing them for regular visits. But then everybody assumes there's no issues with me, so why should I go?
Yeah.
And especially in our community, I know when I deal with adolescents, it's a hush-hush thing that nobody wants to talk about. I mean, what's your experience been, Dr. Patel? On this?
Well, it's one of my favorite visits to see a young girl or an adolescent because it's a very special visit. And I want everyone to know that when you see the gynecologist, you actually have time to spend alone with the gynecologist. Your mother or your father is not going to be there the whole time. And we want to make sure that you are able to trust the gynecologist, and we want to educate you and tell you about your body, tell you about what's normal, about your menstrual cycle, about your sexual health, and it's all confidential. Okay, so we will also spend time speaking to your, your parents, but the main goal is to just educate you about what's important about seeing the gynecologist.
And what actually Dr. Patel just mentioned is very important for young girls to come to us. They're usually afraid because they're coming with their mother or father. They think we're just going to divulge. What usually happens when they come in, usually when the MAs take the patients in, usually the parents are made to sit outside and we take the history from them, and we usually ask them to see what you want mentioned, and so that way only that part of the exam will be mentioned to their parents. So that way it's completely confidential.
Okay, so I do believe now that our viewers who are watching, they will try to talk to the kids to go to the OBGYN, and I do believe that it will be confidential.
Well, I mean, we do a lot of that in our pediatric visits, and anytime there's an issue that we're not able to address, especially for young women, adolescent females, we send them to the OBGYNs.
Of course.
But the fear that a lot of parents have is that, oh my God, I should only go there, I should only take my daughter there if she's sexually active, and oh my God, is she sexually active? That's a taboo topic in our community to really talk about.
Yeah, but it's one of our favorite topics to talk about with our patients, because it's very important to educate them about sexual health and actually what defines sexual health, also what defines identity too. So there's a lot of different changes out there and a lot of awareness, and we want to make sure that we're educating everyone and telling them that it's okay, but they should also protect themselves too.
Yeah, safe practices, because
safe.
Usually parents and their kids, they're not very, how do I say, open with each other. Sometimes parents might hesitate to be very open with them. So you bring them to us. Any questions that they may have, they can ask us comfortably, and the parents don't have to worry about educating them because we're doing that for them.
Okay.
So put your responsibility to the physician.
Yes, absolutely. I think that everybody will agree with that, Dr. Mehrotra. But as we're discussing this thing, I would love to ask you another thing. That when he started that only during the pregnancy, like the women are coming to you and visiting you, what is after that, like the 9-month cycle is done, and then what? Then how frequently they should come to you or visit you?
Well, if I can just interject as well, after the delivery, there is breastfeeding. So, which is actually one of my favorite things to discuss with my patients, because there can be a lot of issues that arise, even when the patients are breastfeeding up to 1 year, 2 years. So we do frequently see a lot of patients, after delivery for bleeding issues, just generally like feeling fatigue, and also postpartum depression is very important. And also, we want to make sure that moms are talking to us about it, because it's a lot of responsibility to have a child, and we want to make sure that they're having support and we're addressing all their issues.
Okay.
And then usually once the breastfeeding part is done, we usually require women to come and see us annually, every year. For a breast exam, pelvic exam, address any menstrual irregularities, contraception, what to do between your children, how to space them out. So it's very important to see your doctor every year, not just for a certain test or anything, but at least to address any issues that you may have.
Yeah, and there's so much that we can cover in the annual exam. I mean, there are some patients that I can spend just 10 minutes talking about weight loss and exercise, because it's just so interesting to hear about what women are doing and what they're not doing.
All right. I am right now very excited.
Opened up a Pandora's box here, right?
Exactly.
When you have a topic like our women's health, it's a huge topic.
So many
right?
things.
So you can just keep on picking out topics and how and what we should be doing.
Totally. Right now, I'm thinking to go to Ushma, because talking about, in that session, we can talk about weight loss as well. So that is quite interesting.
All my tricks.
Wow. Okay. All right.
Yeah.
Because we always go and come out, go and come out. It's mostly in that time. So we don't really spend a lot, and I know that you will be all of our viewers, they're watching us. But seriously, I'm the person who never went to OBGYN for the last 3 years. So please don't make that mistake. I'm truthful.
Thank you so much for owning up to that, Ragini, because that is where I think a lot of our viewers falter, because they just don't want to go. And one of the biggest beliefs that they have is if you go to the doctor, they're going to find something wrong with you, and you should only go to the doctor when there is something wrong. And if you go to the doctor and they find something wrong, they're doing that because they want to make money.
Well,
it's
I mean,
very.
that part is really something. The last part you say, well,
No comment.
I don't believe that in US. But if you ask me about India, maybe I will believe. But in here, come on, that
Yeah.
part is not there.
So if we were to actually categorize out by
Yeah.
every age group, right? So we have adolescents where they're being talked about with their sexual health and menstruations, right? And then you have pregnancy, then they're
Yes.
talking about pregnancy. And then after that it's general routine women's follow-up,
Correct.
right?
Yes.
And then there is another stage which many women deal with, right? I mean,
Yes.
all women deal with is menopause, right? So
Yes.
if you had to interject or guide us as to what are the guidelines in each stage of that, maybe you can take one of those phases and you can take one of those phases
Sure.
and go back and forth on that and let us know.
Yeah, I mean, we already touched upon, pap smears, which are very important because they're part of the cervical cancer screening. We don't start until 21. The only instances where we actually start at a younger age is if we have any patient who has immunocompromise or HIV status. But in general, we start at 21, and we can actually screen every 3 years. At age 30, we can switch to a pap smear, which is cytology screening with high-risk HPV virus, and we can actually space out the screening to every 5 years. Okay, and then later on in life, we can actually graduate the patient once they meet age 65, and if they've
boy.
met all the criteria in the previous 10 years, if they've had 3 negative consecutive pap smears, or if they've had a negative pap smear with HPV testing within the past 5 years.
Oh my God, that's so much information. Did you follow all of that?
Too much, too
Just to
much.
summarize, it's very simple.
Yeah.
You start at 21.
Yeah.
You get a pap smear every few years. If you actually come to the doctor regularly, we'll tell you what the intervals are. You don't have to
Yeah.
worry about that. If a pap smear is abnormal, we'll tell you what the next step is and when to get your pap smear done. The patients never have to remember all these details.
don't.
We usually go over all that with them.
Yeah.
And after 65, age 65, you can technically stop pap smear, just the pap test screening, if your health has been good in the last 10 years. Okay, and you've never had any very high-risk pap smears in the last 20 years. Again, we'll go over that with them. Now, going from pap to mammograms, right? That's another big thing that everybody talks about. Age 40 is when you start doing mammograms, and it's yearly after that. Now, if you have a family history of breast cancer, then we'll start sooner based on what the history is, the type of cancer. Again, we'll go over that with you to see when to start the screening. But it's easy. 40 every year after that.
Okay.
But the key is you have to go to the doctor
Correct.
to get the guidance.
Yes.
Yeah.
So if you
Every
don't
year.
go, so
Correct.
just like you come in for well child
Yeah.
visits with a pediatrician,
Yeah.
you have to make sure you take care of
Yeah,
yourself.
the
and
way
your-
you said it that you have to go to the doctor, I understand that part. the way of the seriousness in your face, I will do that. I'm really promising.
and I hope
you.
everybody who's watching
Yeah.
will do that.
All right. Okay, fine. There is one caller with us right now. Let's see who is this. Hello, welcome to Health is Wealth, and you are with Dr. Mehrotra and Ragini, and two beautiful guests here is Ushma and
Dr.
Dr.
Vimla.
Dr.
Okay.
Patel and Dr. Nataki.
hello.
Yeah, hi.
Hi.
Hi, my name is Vasan.
Hello.
Hi, Vasan.
Hi, Vasan.
Hello.
Can you go ahead with your question, please?
Yeah, not I don't many questions, but I just want to thank One TV team for doing such a great program.
Oh, thank you.
Because one more thing, I'm following the program long time.
Okay.
Oh,
I'm
thank you.
watching almost all the episodes,
Great.
so I think it was very useful.
Okay, thank you very much for your feedback.
Yeah,
and
thanks
if
a
any
lot.
of our viewers have more questions, right, they're more than welcome to call us.
Yeah, absolutely, absolutely. The number on the screen is scrolling. You can always call us in those numbers, and of course, we would love to talk to you. And as Dr. Mehrotra is here, he is ready to give you all the informations about about women's health this month, but of course rather than that, he is open to all your questions, and you can always in our Facebook page, in Mana TV's Facebook page, you can write if there is anything you want to know. You can really inbox us, and you can see that Health is Wealth, it comes every week, so you can really inbox us, me or him, that what is your question or what you want to know. We would love to guide you through. Right,
Of
doctor?
course.
Yeah?
So if we don't get around to your questions or
Yeah.
your information, we're more than welcome to do it after.
Yeah.
So one of the, every year I wanted to get back, there's some new research comes out saying that, mammograms are not that important, pap smears are not that important. What is the current standard of care? I know you went through it, but I'm sure our viewers might have questions about that. Can you just address a little bit on that research that's gone back and forth?
Now, most of the data is coming from countries that practice social medicine, where here, because of insurance and all that, you're able to, you call your doctor and you're able to see your physician regularly whenever you want. But data that's coming to us is coming from countries that practice social medicine, where patients have to if it's a non-emergent situation, they have to wait their turns. What the studies are showing us that before, in the United States, the guidelines were you have to do a PAP every year. But what the study data is showing is that by doing that, we tend to over-test patients, and when the test is abnormal, you tend to do what is called a colposcopy, that follow-up with biopsy. So we're over-biopsying women, right? So women tend to have unnecessary surgeries. So once the data was released, we went to what Ushma was saying earlier, where now instead of doing a pap smear in young women every year, we do them every 3 years.
Okay.
And once after the age of 30, we're going to do every 5 years, so that we don't overtest them. And that way, even if there's, and even if it's positive, the guidelines have shifted where we genuinely are trying to not do major surgery on them unnecessarily.
Okay, all right. All right, here is one question popping in my mind right now. Okay, all right, the gap is fantastic, all right, like the 5 years or 4 years.
Yes.
But what, are the symptoms that they should know and go back to you? Because in those 4 years, you're not doing the test.
Exactly.
So what can we see wrong in us that we should know that, hey, this is the time we have to go to you guys?
Okay, just one thing. Just because I said the pap smear is done every 5 years doesn't mean you go to the doctor every 5 years.
Well, okay.
And I'm so glad you said that,
Yes,
because
exactly.
we're going to try to tell you that,
Yeah?
yes, you should come every year.
Every year.
There's so much
Okay.
more. Yes.
Yes.
So even though we're not doing a pap
Yeah.
smear every year, we still have to talk to you. We have to talk to you about how you're feeling, how your periods are, how your sexual life is, if you're having any pressure, any symptoms, any abdominal pain, any discharge, or possibly any infection. And we do a pelvic exam. So even though we're not doing a pap smear, we still have to examine you and screen you for any problems.
Remember what I said when the show started. Women's health is not a test or a scan. It is overall how to prevent disease in women.
Yeah.
And unless you see the doctor, we're not going to go over preventative efforts with you. But to answer your question, if God forbid you haven't seen the doctor because your life is busy and you've kind of ignored your health, the main thing is bleeding, abnormal bleeding, irregular bleeding. That's usually the first sign that something is wrong. So you need to come in and see us.
Right. So, one of the other things that we also didn't really go into are the breast exams, which we start telling adolescents as soon as they're in puberty to go ahead and start.
Correct.
What are the recommendations on that, and how does that fit in with the mammograms and so on?
I think generally in adolescence, when an adolescent comes to us, if they have a concern about their body, about their breasts, about the genitals, our job mainly is to examine them, and in most cases we reassure them that everything's normal. Unless they're having severe pain or any unusual symptoms, we should be starting our breast exams around age 25. At that point, then they can be every 1 to 3 years. After age 40, it's every year. So earlier than age 25, unless there's any issues, we can actually just do an inspection. We don't have to do any aggressive exam. And now we're also telling the patients to just be aware of their breasts. In the past, we used to tell them to examine their breasts every month, but now it's really the awareness. So for example, if the patient actually feels like her bra feels unusual, or if she's reaching for something in the cabinet and feels any unusual sensation, then that could actually be a clue that that she needs to be seen and checked.
The self-breast exams has unfortunately become controversial now because some societies will say, yes, you still have to do it every month or every few months. And some societies will say, no, you can stop it. There's no evidence that it actually helps and the sensitivity is not that great. Now, what I usually tell young women is, I kind of go with what you're saying, was that examine your breasts, know your breasts. By examining your breasts every few months, you're not trying to identify cancer. You're trying to identify any changes that you can bring to our attention so that we can evaluate and address that.
Right. And I think that's a common thing across the board with any exam. So whenever a child will come in with anything that's abnormal, or a parent will find that, they will go ahead and run into the doctor. Hey, what is this?
Yes.
All of a sudden, I don't know where this came from.
Exactly.
Of course.
And I think that's the most important thing, is to
But,
know about your body.
Yes, that is true. But as you are teaching them, have you got this type of calls as well? That sudden something, but maybe it's nothing, but somebody's panicking out.
Yes.
Of course.
Yeah.
They call in, not just young women, even older women, where all of a sudden, just like you said, they're doing something a little bit more physical than normal, and all of a sudden they feel breast pain. And they examine, and now they feel a lump. And yes, they want to be seen yesterday. Right? And then you haven't seen them in a few years, but they want to be seen yesterday saying, oh my God, I have cancer, I'm going to die.
Of course.
But usually, most breast masses are benign. Usually. But again, I always say, if you find something, don't panic that you have cancer. Come in, let's evaluate it. There's a lot of benign cysts that your breast can have when you're young, and even as you're getting older. And just because not everything that you feel is bad. Just don't ignore it. Just come to us. We'll evaluate you.
Oh,
Yeah.
even with breast pain too. There's so many things that we can talk about. If they've had trauma, or if they're not even wearing the proper bra size. I actually meet a lot of patients who should actually get properly fitted for their bra size, and they actually see that they're a totally different size. So there's a lot that's involved with just breast pain too.
Okay,
Yeah.
all right. So I really want to know another thing, that is certified women specialist or OBGYN. Is it same, different?
It's the same thing.
Okay.
No.
Yeah.
Again, we're the East Coast, okay? The coasts are very different.
I love your expression, Dr. Natake. I love your expression. That was really nice.
No, because I wanted to start saying something. It depends on where you live. Like when you're living in like very metropolis areas, when there's healthcare available to you, there's a lot of doctor options for you. Everything is very specialized. Say, for example, the East Coast around here.
Yeah.
For routine gynec things, you'll come to your OBGYN.
Yeah.
Now, if you're having fertility issues, you have a separate specialist for that. If you're having bladder issues, like later on in life, one of the issues you get is prolapse, where your bladder is prolapsing, your uterus is prolapsing. There's different surgical techniques to fix that. For that, you'll go to a urogynecologist. That's a different specialty.
Okay.
Again, you usually come to a generalist and we'll direct you where to go. There's also when you have a very high-risk pregnancy, we refer you to what are called peri-neonatologists. They specialize in very high-risk pregnancies. So yes, there are some super specializations in women's health. But your starting point is your gynecologist, and we'll
And from there
send
you're
you
going
where.
to direct
Now,
them.
if you're living in other places like in rural areas where you've had like one gynecologist in like say for 2-3 counties, then they're kind of the go-to for everything. You kind of have to start with them for everything. Here you can kind of, even if you don't come to the gynecologist, if you're having bladder issues, you just want to pick up the phone and call your gynecologist, that's fine. You can absolutely go see them.
Okay, all right.
So the amount of information that's out there is tremendous, and it will take us a long time to cover all of these aspects, right?
Yes.
So I think just to, because I know we're running out of time as
Yes,
well, so
we are.
can we recap what are the recommendations that all of our viewers should follow? And definitely we need to get the men involved in this, because they're the ones who are going to give the time to their
Force
women.
them.
Right. So
Force them, yes. And also the kids who are almost grown up, force your parents to go.
Right.
Right?
So,
Yes.
so that we get them because when they have to go off to college, they have to come in for
Yeah.
their exams. So
Yeah.
we are the ones who, we're
Yeah.
the gatekeepers on
Totally,
that.
totally.
But beyond that, I think if you wanted to just recap, what should the women be doing, it would be great, I think, so we can.
I think what they should be doing is seeing the gynecologist every year. And then let us worry about everything
Oh my
else.
God.
There you go. It's aimed at you. Aimed at you.
No, but don't worry.
got
Let
it.
us worry.
Yes.
Okay, got it.
Yep.
And then for women who have young girls, now you know. when they're around, if you have issues, you're going to see the pediatrician anyway, and any issues, they're going to refer us to the gynecologist. But if you ever think, I'm not sure, do I need to take my daughter into the gynecologist's office, just pick up the phone and call us. We'll tell you if your daughter is ready or not.
All right.
And it's always good, they can just come in, and then we'll teach them, and we'll teach young girls how to follow us, when to come back, when to see us.
Actually, before we finish our episode tonight, I think there is somebody else who wants to talk to us. So let's welcome. Hello, you are watching Health is Wealth, and you are live with us. May I know who is this, please?
Hi, my name is Sai.
Hi, Sai.
Hello, Sai. Hi, Sai.
Hi, how are you?
I'm great. I'm great. How are you doing?
I'm great.
Okay, all right. So, how you think that you are going to support your
What's
your
your
household?
question?
No, I'm going to ask this: how he's going to support his household? Hello.
Hello?
Yes. Yes. Please talk. I'm sorry.
Yeah, sorry, say that again.
I'm saying that how you are going to support your household. I mean, maybe your wife or your mom or your sister, make them go to OBGYN for yearly checkup. How are you going to make that
You're
happen?
putting him on the spot. I think Sai has a
Yeah,
question.
absolutely.
Sai, let's just get to the point, Sai. What's the question? Ragini, don't know. What's your question, Sai?
Yeah, well, actually, I have a question that usually for women pregnant, we have a saying that when they have saffron, like it will be good for, kids will have they get good color. So, I don't know if you have heard about it. So, is it real or is it a myth?
Now, I know what he's asking me. To repeat the question, he's asking me, if pregnant women drink saffron, add saffron to their milk after 20 weeks of pregnancy, will the babies be born with a fair skin?
Okay.
Unfortunately, no. I think your babies are going to be born like mommies and daddies. So I think genetics plays more role.
Right.
You know?
Right. So a lot of, I think, mythologies out there. A lot of old wives' tales are out there, and people do.
A lot of
do have
myths
these
are out
beliefs.
there.
Yeah, there's a lot of myths, and that's okay. This is a
Yeah.
perfectly good question
Yes.
because I think people need to be made aware that this
Yeah.
is a myth and it's not the reality.
Yeah, true.
So there's no harm in taking saffron, as far as I
Correct,
know,
yes.
during pregnancy.
Yes.
It's going to actually, be beneficial if they want to take it, but it's not going to change the color of your baby's skin.
Yes.
So.
Is there something like, if we do something, can we, is it controllable? Like, can we control the color of our kids or anything? Like, if I take something else by taking some vitamins or anything, or is it in our hands?
Unfortunately, you cannot because
No.
it is based on the genes,
Genetics
the
and
genetics.
environment. Depends upon which country the woman is pregnant in, what things that are the woman is exposed to. There's a lot of environmental influences, but usually it's DNA.
Right. So, thank you very much for your question. And
Thanks, Sai.
Thank you.
Thanks, Sai. Thank you
Yeah,
so much for calling.
thank you
in.
very much.
Yeah, thank you. Well, lots of stories out there, huh?
Right, yeah.
Well,
but
it was.
I'm glad that our viewers
Yes.
are listening and they are actually hoping that they're
Wow.
getting some proper information out here.
Okay.
And we really want to thank both of our guests
Yeah.
for coming out and educating our viewers about women's health. So women's health is a big topic.
Correct.
And that women need to be empowered to go to the physician
Yes.
and to make sure that they go annually.
They have to make it a priority.
Absolutely. And with this beautiful note, I would like to end our show tonight and hope to see you all again next week. Of course, Wednesday, 7:30 to 8, and the platform is only from Mana TV. Thank you so much, doctors, and please feel free to come back again
Absolutely.
in another episode where we can talk more for
Yes.
us.
Okay.
Yes, absolutely.
Thank you very much.
Thank you.
Thank you for
a lot.
having us.
Thank you for
Thanks
having
a
us.
lot.